Good morning all. I am Dr. Ravi, postgraduate from the Department of General Medicine, and today I am here to talk about the pneumonia on occasion of World Pneumonia Day. So what is pneumonia? So pneumonia is nothing but infection of the lung tissue, and based upon the clinical settings, pneumonia is divided into community acquired pneumonia, hospital acquired pneumonia, and ventilator associated pneumonia. So what is community acquired pneumonia? Community acquired pneumonia is nothing but pneumonia that acquired through the community, and hospital acquired pneumonia is that pneumonia that is seen in the individuals following 48 hours of hospital admission, whereas the ventilator associated pneumonia, it is seen in the sick individuals following 48 hours of intubation. So on every year 12th of November we celebrate it as a World Pneumonia Day. So the prime reason behind is to create the awareness among the public regarding this major health burden. I am saying it as a major health burden because if you look at the incidence values, so in every year for every 1000 of population, on an average of 20 people are suffering with pneumonia. So if you talk about the mortality rate, particularly in India, and annual deaths of 30 people for every 1 lakh population has been reported in India. So to talk about the incidence among the children under 5 years of age group, so 156 million individuals were suffering with the pneumonia, and of them 1.6 million children are losing their lives. And to talk about the current COVID pneumonia, so which is a pandemic that is going on all over the world, as of now 50 million cases are reported, and among them 1.2 million people lost their lives. So to talk a little bit more about the pneumonia, so what causes the pneumonia? So pneumonia is caused by the infection of either bacteria or a virus or a fungus, and most of the pneumonias are viral in children, and most of the pneumonias are bacterial in case of adults. So looking at the mode of transmission, so when a person infects with the pneumonia, so when he coughs or sneezes, there will be generation of the aerosols or droplets into the air. So when these droplets or aerosols are inhaled by the healthy person, so that he or she may acquire infection. So coming to the risk factors, so following up the individuals, they are more to develop pneumonia, elderly person having the age of more than 65 years, and those who are having the chronic comorbidity conditions, say diabetes, hypertension, and coronary risk factors, CAD, and cerebrovascular accidents, and immunocompromised states like in HIV, and those who are on the long-standing steroids, on long-standing chemotherapy drugs, and those who are suffering with the chronic structural lung disease, say COPD, bronchial asthma, bronchiectasis. So coming to the symptoms, with what symptoms they usually present with. So individual may present typically with symptoms like fever, which is of high grade, can have the cough with productive sputum, and may have the difficulty to breathe. And some individuals may present with the atypical symptoms. It may start with the upper respiratory tract symptoms, say fever, may have the running nose and sore throat, and they may have the symptoms not related to the respiratory tract, say like pain abdomen, vomitings and loose stools, and later on these individuals will develop the full-blown pneumonia symptoms like cough and having the shortness of breath. So we usually make the diagnosis based upon the symptoms, clinical findings, and with the help of the relevant blood and radiological investigations. Regarding the treatment aspect, so treatment varies depending upon the severity and the type of the etiological agent, and we usually use a CUP65 score to categorize the severity in case of community acquired pneumonia, and other indices, pneumonia severity index also present, but we commonly use a CUP65 because as it has got only 4 variables and it is easy to assess them. So based upon the CUP65 score, we categorize the individual whether the patient needs outpatient treatment or inpatient treatment, or he need to be admitted to the ICU and to be started on oral antibiotics or IV antibiotics, and if needed antivirals or antifungals depending upon the clinical scenario. Now coming to the prevention aspect, which is of prime importance now. So cessation of the smoking is a most important thing, and cut down the chain of transmission. As we know that it spreads from person to person through the airborne transmission. So the one who having the symptoms need to follow the respiratory hygiene and cough etiquette, which means, so if the person is having a cough or let's say sneezing, all these symptoms, need to avoid the public gathering and need to wear the mask, and whenever he coughs or sneezes, try to avoid to cough or sneeze in the direction of the others, and try to use the tissues and discard it the appropriate places. If tissues are not available, at least cough or sneeze into the crook of the arms. And most important thing is maintain the hand sanitization as well. As of COVID-19 pandemic is going on, it is important to emphasize on the three important things. That is, as we all know, maintain the proper social distancing, at least 3 to 6 feet of distance, say 1 arm distance, and wearing the mask is mandatory, and follow the safety hand hygiene measures. And the final thing is the vaccination. So pneumococcal vaccines are available. So pneumococcal vaccine are generally, so what is pneumococcal vaccine? Pneumococcal means nothing but it is the bacteria. Pneumococcus is the bacteria, and among the bacterial pneumonias, the pneumococcus is the most common bacteria. So the individuals who I already discussed, who are at risk to develop the pneumonia, they need to take the pneumococcal vaccination. And the pneumococcal vaccination are of two types, polysaccharide vaccine type and another one is the conjugate type. Generally we prefer the conjugate vaccine because it has got more antigenic property and it mounts a high immune response. Hib vaccines are advisable in children. They are already included in the WHO immunization schedule. And finally, to conclude, on this World Pneumonia Day with the theme, Stop Pneumonia because every breath counts. Thank you.